Hello everybody, this is Dr. Langlois of the Pet Pantry of Lancaster County. I'm the medical director and the staff veterinarian here, and I'm probably also the one that went ahead and spayed and neutered your little feral feline friend. And I'm just going to talk to you very briefly about some important discharge information regarding your cat and things to make sure you take care of and do so that the cat recovers as quietly and as peacefully and everything goes perfectly and you won't have any problem post-operatively. So the first thing to remember is that these cats obviously are knocked out with an injectable anesthetic. And that anesthetic and the pain medication that's associated with it will last in their system for a good 24 hours or so. Because of that, you will notice that most of your cats are probably a little loopy, a little disorientated, staggering a little bit in the carrier or the trap when you pick them up. Because of this, it's very important that you have an area that is nice and quiet and warm and dry that you can keep them in overnight. You can keep them covered with a towel, whatever you have to do, but you don't want to release them the night of surgery. And this is very important because with them being disorientated, they're not going to completely know where they are. There's the potential for them to run into traffic, injure themselves in other ways when they're trying to get away. We've just seen some really bad instances of things happen when they're released too early, so remember that. As far as food and water goes, you certainly can, if you can get it in safely, a little bit of food and a little bit of water this evening if they are standing or sitting up in their carriers or crates. Canned food usually works best, but you can kind of use whatever you want to potentially use in that situation. So remember that as well. Don't worry so much about using a litter box in there or anything like that. Even if there's a little bit of an accident, the cats will be okay. When you release them the following morning, you'll just be able to, clean out the carrier afterwards or the trap afterwards, and they will do fine. It's not a good idea to keep them in their traps or small carriers for more than a day and a half. And if there's something that requires you to do that, you will have to talk to us about transferring them into a larger cage with a litter box or a crate or something like that to be able to take care of them. So that's the most important thing to remember when you're dealing with those types of things. So those are just some important tips. If you do notice anything potentially wrong with your feral cat, certainly feel free to give us a call back. We certainly can potentially examine it or see what's going on. Obviously, don't worry so much about checking the incision areas on these guys. You're not going to be able to do it. We use all dissolvable sutures in everything that we do, so you don't have to worry about stitches coming out. You don't have to worry about causing irritation or things like that. The cats will know what to do. They're ferals. They've been outside. They're pretty good. You will also notice again that their left ear has a very, very small tip taken off, and that is the universal sign that that animal has been spayed and neutered and received their rabies vaccination. So those are all just some important little tidbits for you to keep in mind when you are taking care of your feral friend. We again do thank you for bringing them in and making use of our TNR clinics, as this really is the only way to help control the feral cat population and take care of any potential disease issues that arise in the feral cat population. So again, if you do have any questions, certainly feel free to give us a call here at the Pantry. The phone number, as you can see, is right here, and we will be able to help you out. You also can potentially contact us via email and our Facebook page. So again, thanks for taking use of our clinic, and we will hopefully see you in the future.